From hospitals and at homes too, wherever they work, doctors and nurses worldwide are battling what's described as the invisible enemy. They should be using what's known as personal protective equipment, including medical masks, gowns, gloves and eye protection, some designed for single use and immediate disposal. More cases mean more discarded gear, more medical supplies used, and that means medical waste on a scale never seen before.
The problem is really to find a place, an area where we can store temporarily the containers that contain those all those used and contaminated equipment. This is really the main issue.
Figures from China show that when the pandemic was at its peak in February, 159,000 tons of medical waste were disposed of in 6 weeks since late January. 240 tons of that was from Wuhan alone, every day. China had to construct a medical waste plant to cope. With many patients recovering at home and some who are infected but show no symptoms, workers who collect household refuse are also at risk.
We have to tell people to avoid throwing trash in piles like that. It would be better if they put it in bags. That way we avoid touching as much as possible and we avoid the risk of getting infected with coronavirus and other diseases.
As the US joins other countries in recommending wearing masks, not disposing of them safely increases infection risk.
The virus can stay on outside the surgical mask for 7 days, as long as 7 days. So if you're a sick person, the contaminated side is the size of the mask that facing you. So you fold up the size that facing you. If you're healthcare workers, the contaminated side is the size of mask that with color, the size that facing out the outside environment. So you try to fold it up another way around.
In a world besieged by the new coronavirus, the expert advises the health risk can be reduced, but only if everyone follows the rules. Priyanka, Gupta, Al Jazeera.